Welcome to our channel Examine the BDS. I am Dr. Dinesh. Today we are going to see about Avulsed tooth. Whenever a tooth comes out along with its root during a trauma or an accident, it is called as Avulsed tooth. This commonly occurs in children. Now let's see its clinical management. Here, reimplantation is the choice of treatment. The single most important factor in the success of reimplantation is the speed with which the tooth is reimplanted. Every effort should be made to replant the tooth within 15 to 20 minutes. When the tooth comes out, the patient should be first instructed to hold the tooth by the crown, wash the root gently in running water or saline, and place it back in the socket as atraumatically as possible. If the patient is uncooperative and crying and reimplantation is not practical, we should immediately store the tooth in appropriate media. This includes medium like milk, saline, Hank balanced salt solution, or it can also be stored in the vestibule of the mouth. Milk is considered best for this because it is readily available at or near an accident site. It has a pH and osmolality compatible to the vitality of periodontal ligament cells. Once the patient reaches our dental clinic, first we should gather information like where the tooth was recovered, its dry time, storage media, so that we can give them appropriate treatment. If the tooth was replanted immediately at the site of incident, we should verify its position with the help of an IOPA. And then we should reposition it as required. If it's not replanted immediately, we should consider other factors like time and dryness. Depending upon the time and dryness, our treatment protocol may vary. If the extraoral time was 15 minutes to 6 hours stored in milk or Hank's balanced salt solution, we should soak it in 1% doxycycline for 5 minutes. That is 50 mg capsule dissolved in 1 liter of saline. This will act as an antimicrobial agent. If it was stored in non-physiologic media like water and saliva, it should be changed to Hank's balanced salt solution within 2 hours. If the extraoral dry time was more than 60 minutes, we have to soak it in citric acid for 3 minutes. Then we have to rinse well and remove the periodontal ligaments gently with the help of a scaler. After that, we have to place the tooth in sodium fluoride for 20 minutes. Once all this is done, we have to gently rinse the socket to clear the clot and debris. Palpate the socket for checking alveolar fracture or socket wall collapse. If the alveolar bone has collapsed, a blunt instrument should be inserted carefully into the socket in an attempt to reposition the wall. After reimplantation, compress the facial and lingual bony plates. We have to give a flexible splint to keep the tooth in position while allowing some amount of movement. This reduces the incidence of ankylosis. This kind of semi-rigid fixation is recommended for 7 to 10 days. Flexible splinting can be given with the help of fish wire or even dental floss using light cure composite. The splint should be removed after 10 days during the second visit. Lip laceration is common with these types of injury, so the lip wound should be cleaned and sutured. Other soft tissue lacerations like socket gingiva should be lightly sutured. We have to prescribe the patient with systemic antibiotics for 5 to 7 days. We should give the patient a shot of TT injection. Since brushing is difficult, mouth rinsing should be advised. We should instruct the patient not to bite on the splintered teeth. Endodontic treatment like apexification, apexogenesis, root canal treatment should be carried out in the following visits if required, depending upon the apical closure. This topic ends here. Let's see today's bonus fact. Information travels along our nerves at the speed of 400 km per hour. If you like this video, share and subscribe our channel. Thanks for watching.